Hello, I'm Dr. Richard Robles. I want to thank you for taking the time to watch this video. The fact that you're watching me right now means that you're actively seeking a solution to your thyroid condition. My goal is to answer two basic questions for you. Why do you have this condition? And what can be done to get your health back? The incidence of thyroid conditions has been steadily increasing, so much so that 1 in 8 women can expect to be diagnosed with thyroid disease in their lifetime. The most common thyroid conditions are hypothyroidism, hyperthyroidism, and thyroid cancer. In this video, I'll primarily focus on hypothyroidism because it represents 95% of the population of people suffering with thyroid problems, and it even affects many people with hyperthyroidism or thyroid cancer after having the gland removed or destroyed. The big question is, if your doctor knows the cause, why do so many patients continue to suffer with thyroid symptoms? There are two primary reasons. First is the treatment. The main goal of thyroid medication is to normalize the TSH levels in your blood, and it's assumed that that'll correct any underlying problems. I'll explain this in more detail in just a minute. And second, people are not educated on maintaining their health. Instead, they're taught to be on the lookout for disease. And there's a big difference between watching for disease and actively managing and maintaining your health. So let's get into the information. Hypothyroidism describes conditions when thyroid hormone function in the body is low. This can have a number of causes. However, medically, the treatment is the same irregardless of the cause. This one-size-fits-all approach to hypothyroid conditions has not changed since the 1950s. That's when synthetic thyroid hormones were first introduced into the market. Unfortunately, for those who suffer with thyroid symptoms, the medication only relieves the symptoms about 10% of the time. Now don't get me wrong, the medication helps save lives, and it can prevent some of the serious damage caused by prolonged low thyroid hormone in the body. But this is the problem. In many cases, thyroid symptoms and even the thyroid hormone decreases are not due to problems with the thyroid. Let me repeat that, and I suggest you write it down because it's really important. Most hypothyroid symptoms are not really a problem with the thyroid. And here's where many people start asking questions like, what does he mean it's not a problem with my thyroid? He's a chiropractor, he's not an endocrinologist. How can it not be a problem with my thyroid if all of my other doctors have confirmed the diagnosis? I'll answer those questions for you, and more importantly explain it to you so that you can learn for yourself why you still suffer with thyroid symptoms despite taking the medication and having normal lab results. For those of you who haven't had the rainbow shining and unicorns dancing around after taking thyroid hormones, but instead have been to doctor visit after doctor visit for years changing your hormone dosage because you still have symptoms, and adding more medications to chase the new problems, I'm going to help you better understand what's going on. And that's what real doctors like me do. We teach. That's right, doctor is rooted in the Latin word docere, meaning to teach. This doctor, this chiropractor, will finally help you understand what may be going on with your body. You see, there are many causes of thyroid symptoms. However, to keep this video long, but not really long, I'm going to go over the top 6 causes. First, primary hypothyroidism. This is the condition your doctors are actually treating no matter what may be the cause of your symptoms. When it is the cause, it's where your endocrinologist or family doctor shines. These people are in the lucky 10% for whom the sun shines brighter and the grass is greener with thyroid hormone medication. They have a primary thyroid problem and need more hormone to enable their body to function better. In this case, the patient has thyroid symptoms and goes to see their doctor. Labs are drawn and they find the TSH is elevated, so the doctor prescribes thyroid hormone. The TSH is rechecked in 6 to 8 weeks to see if it has returned to the normal lab range, and they hope that the symptoms have gone away. Reason number 2, pituitary hypofunction. The pituitary gland is the part of the brain that makes thyroid-stimulating hormone, also known as TSH, or thyrotropin. When the pituitary gland is stressed, it can reduce its output of TSH. When this happens, it can result in hypothyroid symptoms. Common causes of decreased pituitary function are prolonged high stress levels, inflammation, pregnancy, especially after the baby's been born, and taking too much or too high of a dosage of thyroid medication for extended periods of time. Number 3, decreased T4 to T3 conversion. As you may know, after the thyroid gland has been stimulated by TSH, it creates 2 primary hormones, named for the number of iodine molecules in them, T4 which has 4 iodines and T3 which has 3. Approximately 93% of the output of the thyroid gland is T4, and about 7% is T3. And here's the catch. T3 is the more biologically active hormone. When your body works to regulate or increase metabolism, your T4 must first be converted to T3. Remember that the majority of thyroid hormone produced by the body is T4, so the ability to convert T4 to T3 is crucial for your body to properly create energy. About 60% of this conversion takes place in your liver, and about 20% takes place in the digestive tract. That means that digestive health is paramount for normal use of thyroid hormone, and it doesn't matter whether it's the T4 your body makes or the T4 medication that you may be taking, like Thyroid or levothyroxine. It must still be converted to T3 for you to have the ability to regulate your energy levels properly. Common causes of underconversion of T4 to T3 are dysglycemia or abnormal blood sugar, inflammation, dysbiosis, also known as inappropriate microbial growth in the intestines, pH issues in the digestive tract, genetic variations, and food sensitivities. The fourth cause is increased T4 to T3 conversion. Yes, too much conversion into T3 can also be an issue. One reason is because of the influence that too much T3 has on the feedback loops that allow for regulation and use of hormone in the body. The altered regulation of hormones inevitably results in hypothyroid symptoms, and it's one of the reasons why patients go through what I call the honeymoon phase with thyroid medication. The overconversion works well to increase energy initially, but as the feedback loops and hormone regulation disruption rebalance, the honeymoon's over and the symptoms return. Common causes of overconversion of T4 to T3 are elevated testosterone, polycystic ovarian syndrome, and the last one is a big one, insulin resistance, caused by persistent elevations in blood glucose, typically from eating too many carbs for your body for too long. Unfortunately, this is part of the standard modern diet and one of the reasons why we have so many chronic health diseases in industrialized countries. The fifth cause, elevated thyroid binding globulin. Thyroid hormones exist in two forms, bound and free faction hormone. Hormones are typically bound to a protein for transportation to different body sites. Once at the target tissue, they're unbound and free to be converted or used to drive metabolism. Think of the binding proteins like taxicabs. The hormones get into the taxicabs and go to their destination where they can exit the cab and go about their business. The hormones have to be outside of the cabs or unbound and free to do their job. When there are elevated binding proteins like thyroid binding globulin, too many hormones are bound and not available to stimulate energy production, and therefore hypothyroid symptoms can begin. Common causes of elevations in thyroid binding globulin are hormone replacement therapy, such as birth control pills, menopause medications, and anything that raises estrogen levels in women. Reason number 6, impaired sensitivity to thyroid hormones. Thyroid hormones have to bind to specialized receptor sites to affect the metabolism of different tissues. When this process is disrupted, the hormones are not allowed to exert their full influence on the target tissue. This effectively decreases the action of the hormones as if there were not enough, and hypothyroid symptoms can then develop. Common causes are chronic stress and inflammation, taking too much thyroid medication, prolonged use of thyroid medication, sustained T4 to T3 overconversion, and genetic variations. Most of the time, after I've evaluated a new patient with a thyroid condition, I find that they don't have just one of these problems, but several. This is mainly because most doctors and patients are not taught to look for health, but rather to be on the watch for disease. This leaves many people with the illusion that they're healthy, but upon examination I find that they've had poor health habits for an extended period of time, and are therefore not healthy like they think they are. Now I'd like to bring it all together for you, but first I have to address the elephant in the room: autoimmunity. Autoimmunity describes a condition where your body's immune system attacks your own tissue. Over 95% of all thyroid conditions are autoimmune in nature. That means that 95% of people who suffer with any thyroid condition have an autoimmune attack on some part of their thyroid. This is a big deal. The sad thing is, your doctor's treatment doesn't change whether or not your body is attacking and destroying part of your thyroid. Most of the time, your doctor won't even test for autoimmunity. This is because it doesn't change how they care for you. Autoimmunity is a problem with your immune system, not your thyroid. The key is that you have to address whatever is causing stress to your immune system. And this is the missing link in current thyroid case management. The conditions that I mentioned as common causes for hypothyroid symptoms are also some of the driving forces behind the disruptions of normal immune health that cause autoimmunity. The way that your condition is being handled now is like having a car that doesn't get up to the right speed. Your doctor sees that the tire is flat and continues to put air into the tire on your car, even though there are autoimmune nails poking holes in the tire and destroying it. which he should look for, but it doesn't matter to him because you have a flat tire which needs air and he only has a pump. Not to mention that they've neglected to tell you that using jet fuel instead of gasoline to run your car won't allow it to run correctly. This is like having poor dietary and lifestyle habits. In this case, it doesn't matter how much air you put into the tires or how much jet fuel you put into the car, it won't run correctly, and it can even make things worse. In other words, you can't medicate your way to good health. You have to take the time to find out what's wrong and correct the problems. That's why so many people continue to suffer. So now what? Take a moment and think about the information I just gave you. Knowing all of this can make some people feel even more lost. How do you identify what the problems are for your body? And more importantly, how do you fix the problems? That's my specialty. The first step is the thyroid case review consultation. In this case review, I'll take a thorough history and perform a neurological evaluation. This allows me to find out when you lost your health and what the contributing factors are that led to your symptoms. We can identify if there are nervous system problems that are disrupting your brain's ability to coordinate hormone release. This also gives us the opportunity to assess the severity of the problem and to determine the patterns of dysfunction that are likely causing your thyroid symptoms. I'll review any lab work to see where the patterns of dysfunction are that your doctor does not evaluate nor address. And as I mentioned before, most patients have not had adequate lab work to allow me to identify the problems I outlined above. By reviewing your previous lab work, we can see what additional tests are needed to get a better clinical picture of your health and where you lost it. The thyroid case review consultation takes place over 2 office visits, and I recommend bringing your spouse or another competent adult with you so that you can both ask any questions that you may have. After reviewing your case and determining which patterns may be causing your thyroid symptoms, we can then determine the proper lab testing, treatments, and dietary and lifestyle changes needed to improve your health and decrease your symptoms. I'll go over the cost of care in my office, the fees for any lab work and interpretation, as well as the changes in your symptoms that you can expect from care in my office. If you've been suffering with thyroid symptoms and you've done everything your doctors have told you, or you have normal lab tests despite not feeling well, there is hope. Now that you've watched my video, your next step is to contact my office and schedule your thyroid case review consultation. I'm Dr. Richard L. Robles, and I look forward to helping you find your path to health.